painful periods are normal, so
Ah,
I should just deal with it.
oh my God. This is usually when people say like, what's one thing you want to leave as a message? I'm like, that is my one thing is that, severe pain is never normal. Like whether that's pain with periods, pain with sex, like vaginal pain, like that sort of thing. Like, there's so many times that like female pain, especially is very normalized that everyone has bad periods. Everyone has pain with sex at some point. Like, no, like, that's not true.
Does birth control cause infertility? Does using birth control change who you are attracted to? Is your period pain normal? Even if your doctor says it is it really? Are your hormones in balance? Are you questioning whether you should get your hormones tested? Today, we're going to be asking gynecologist, author, and social media expert Dr. Karen Tang these questions and more. We're going to be debunking some common misconceptions all about your reproductive health. Welcome to the Baby or Bust Fertility Podcast, the podcast with in-depth discussions and interviews with experts in the field to answer all your questions about reproductive health. I'm your host, Dr. Lora Shahine, a double board-certified OBGYN and reproductive endocrinologist, helping people build family and answer questions like this for over 20 years. Today, we have a very special guest, Dr. Karen Tang, on the show to answer some common misconceptions and debunk some common myths about reproductive health. Dr. Tang is a board-certified gynecologist and minimally invasive surgeon and is internationally recognized as a leader in reproductive health. Dr. Tang loves educating, whether it's on TikTok or Instagram. She has an incredible following, does an amazing job of educating, and recently published a wonderful book called It's Not Hysteria, Everything You Need to Know About Your Reproductive Health and You Don't. So today we are welcoming Dr. Tang here on the show to answer some common misconceptions about reproductive health. Let's get started. Well, Karen, welcome back to the show. I had so much fun with you talking about endometriosis.
Let's keep going. Yes.
Let's keep going.
Yes.
And a lot of what we're going to talk about today is so much of your book, your incredible book. It's Not Hysteria.
Thank
oh my
you.
gosh. This is, and by the way, beautiful cover.
Isn't it lovely?
It's
Yeah,
very
I call it
lovely.
rainbow vulva, or vulva flame. From far away, it just looks like a beautiful rainbow fire of some sort.
It does. It's very Georgia O'Keeffe-esque. I dig it. Yeah.
It was just a finalist in the Goodreads Choice Awards.
I voted for you. I hope
yes.
everyone did.
So by the time this episode comes out, we'll find out if
yes.
I'm won or did not. But it's very exciting.
Good vibes. Yeah, it is.
Very exciting to have. In general, like nonfiction book lists, just by the way, like are always like men. It's always like male authors writing about politics or writing about like living forever. So it's very exciting just to kind of make that list as somebody talking about women's health and reproductive health was very cool. So.
And it's so necessary. And so much of what you do is kind of bust myths and sort of deconstruct misconceptions. And so I have 10 myths that I want to go over.
I can't wait to hear what they are.
And so I know, and I love, you are going to be totally surprised. So
it's gonna be fun.
Karen does not know what I'm going to ask her. So let's start with number one. And I do have opinions on these too. So I might kind of add my
for sure. Yeah,
if you don't mind. But let's start with a very common one. Myth number one. Birth control causes infertility.
Oh my gosh. There's going to be some of these, if you're not watching the video, where I just go, and like, it's a physical reaction to it, but So this is a huge myth. And I always tell people, like we were kind of talking about with the endometriosis episode, there's like always like kind of like a something that is like just faintly true enough that people kind of think it's true, but it's not. So the reason that like this myth exists is, say someone is on birth control from the time they're 18 to the time they're like 48. And when they try and get pregnant after stopping the birth control, they're 48. And obviously, their egg number and their quality is not good. So it's not that the birth control made them infertile. It's that time has passed. So it sort of got associated with like, if someone was on birth control for a long time, it made them infertile because they came off and then they had difficulty getting pregnant. Yeah. So, but obviously there's never been shown any sort of long-term influence on your fertility, any of the methods, birth control pills, the IUD, any of it. And in fact, most of the ones that stop quickly, like birth control pills, NuvaRing, IUDs, like as soon as you stop them or you remove the IUD, like you're going to be able to get pregnant right away. That's why people can get pregnant if they forget one pill of their birth control. pills. It's out of
Yeah.
the system so quickly.
Yeah.
So it shouldn't have any sort of long-term impact. But like I
Yeah.
said, so if you hear that, it's false, myth.
I
Don't
totally
listen.
agree. And the other thing that I think of is because I see people so often that have come off birth control pills and they're having difficulty
Mhm,
conceiving. And so they ask me as a fertility doctor, like, well, did the birth control pill cause this?
mhm,
And so I think the birth control pill masks a
mhm.
lot of things that
Yes.
do cause infertility. Like it
Mhm.
masks the symptoms of endometriosis.
Endometriosis.
So
Yep.
you're not having pain while you're on the birth control pills and you stop it and then you're having pain and you're also
Yes.
having infertility. And so you see that correlation, but
Mhm.
it's not a causation.
Yes.
And the other really common one is that it masks the symptoms of PCOS or
Mhm.
polycystic ovarian syndrome.
Yep.
So people say, I've always had regular periods.
And then I came
And
off my
then
birth control. Yes.
right, and then or I have to elicit it. They'll say, "I've always had regular periods, and then I started to try to get pregnant, and all of a sudden my periods are irregular." I'm like, "Well, were you taking birth control pills?" And they're like,
Mm.
"Oh yeah, I
Yeah.
stopped my pill, and then now I'm not getting periods, so it's the pill that is
Yes.
causing." And it's just that, oh my gosh, those bleeds on a
Mhm.
pill are not the result of ovulation or your own
Mhm.
body building up a lining to shed. It's just the exposure to the estrogen and the progesterone and the withdrawal that causes a bleed, but they do not cause
Mhm.
endometriosis. They
Yes.
do not cause PCOS. And it's you and I both, I mean, it's like preaching to the choir, but
Mhm.
it's so important to understand that this narrative is actually causing a lot of harm
Oh,
because there's a
people
lot
avoid
of,
birth control.
yeah,
Yeah, they think it's gonna make them infertile. Yeah, it's
exactly.
very
And it
scary.
can, right. And not everyone needs to go on birth control.
Mhm.
And you and I both have been in medicine for a long time. And there are absolutely people that have pass on falsehoods like nobody has side effects with birth
Mhm. Oh,
control
yeah,
or
exactly.
everybody needs to be on it. Like neither of those things are true. But oh my gosh, like there are people suffering with
Mhm.
symptoms from things that could be helped with birth control. So there's some
Yeah.
harm in this myth.
Exactly. And so what you mentioned has also been said about things like tubal sterilization because
Mm.
once they don't need the tubes or they don't need birth control anymore because they've had a sterilization, you come off of it and then suddenly your periods are more painful, they're more heavy, you have more regular periods, you have more like migraines and acne, and people think it's because the tubal caused it. But no, it's not the tubal, it's because you stopped the birth control that was suppressing all those symptoms. So people say that too. They're like, "Oh my god, I had a sterilization and suddenly all my periods were terrible." And the question is always like, were you on birth control before?" Yes, and now you're not. And
Oh
so
my
a lot
God.
of that myth came about because not because of the thing itself, but because it led to then stopping the birth control, which had been controlling the symptoms. That's actually a great, great, great point about like, is
Yeah.
it the actual birth control? No, it's like just like that. So.
It's just so hard because there are so many grifters online
Mhm,
that are playing into that narrative in order to
mhm.
sell a class or a supplement or a
Detoxes. Yeah.
detox in order to fix this horrible thing that
Mhm,
the birth control pill caused. So thank you
yeah.
so much
Oh,
for
of course.
clarifying that. And
There's when you talk about, like, the grifters, like, they're just all these, like, wellness, like, like,
yeah,
they're most of them are not medical. Like, there's a lot
yeah,
of dudes who are like, "I'm a fitness expert/hormone slash hormone expert selling a detox," and they just say all this crazy stuff about, like, the dangers of birth control, it's gonna destroy your body, "Buy my detox," like, which has no
yeah,
safety data, no efficacy data, and is, sold on TikTok. So, be very, very cautious. If you hear someone talking about the dangers, look at their conflict of interest, which is usually like if you look in their bio, they're selling something like a course, a
absolutely.
detox, like a something or other, and they
Yeah.
use the misinformation to kind of make people scared, and then they drive them to buy their thing, and so
Yeah,
yeah.
absolutely. I appreciate your talk on social media.
Mhm.
You came to Seattle within
Yeah,
the last couple of months,
yeah.
and I got to hear you talk on that. And you made such a good point that so much of social media is like causing fear to get
Mhm.
attention, get that hook, and then telling people what their problem is, and then trying to sell them the solution.
Mhm.
And it's just over and over and
Yeah,
over
they create a
again.
problem and the solution and then
Yep.
monetize the solution. So yeah,
Yeah,
like they're like, "There
exactly.
was no problem." Like,
Yes,
yeah,
totally. Thank you,
yeah,
thank you. Okay,
yeah.
myth number 2 is
Mhm.
another birth control one. Myth number 2, taking birth control is gonna change who I am attracted to.
Oh my god. This is the same thing. I don't understand. There's so many of these videos, mostly by
Yeah,
men.
Yeah.
Like, again, where they're just like, "It's gonna make you attracted to the wrong person." And,
Yeah.
I looked this up once because I was just like, "What is this guy even talking about?"
Yeah.
And there was, like, some tiny study. I'm sure there's, like, more than one of these, like, little ridiculous studies that had, like, 10 people in it, and it was, like, about sniffing T-shirts. It's like they gave people T-shirts to sniff, and then
Mhm.
it was like that if you were on birth control, you preferred the scent of people who were more biologically similar to you. It wasn't even like it didn't even make sense medically. Like, what is this outcome? But people basically just took that and like was like, oh my God, birth control is going to make you attracted to the wrong person. And what does that even mean?
Wow.
Like the wrong
I
person,
know.
or
I
change who you're
know.
attracted to? And my response to that on a video was like, I mean, I would hope that people are attracted to more than just like how someone smells, or that
Oh
it's
god.
something about
Mm.
personality or having
Yeah.
like a fit, and over time like getting to know someone.
Yeah.
It's not just like that you have some like you're overtaken by this hormone which has made you a different person.
Yeah.
So I mean, and I again, just like you said, like people do feel differently on birth control. Like some
Yeah.
people do have adverse effects, like they may have like
Absolutely.
mood changes or things like that. That's not like unreal, but like what gets done is like they sort of take like something and then they blow it up into this big like frightening headline. Like they don't explain what it means or where they
Yeah.
got this kind of idea from, but they're just like, it's gonna make you like, it's gonna change, it's gonna make you not attracted to your spouse, or it's gonna make
Yeah.
you make bad decisions with your relationships or something. And
Yeah.
I kind of was like, I hope people are more than just like the puppet of their hormones. But
Yeah.
yeah, so that I think is ridiculous. Like there
Yeah.
there are, if you search enough in literature to find something to support something you want to say, you probably find it. So like that's not to say that there aren't these like tiny kind of terribly designed studies that say something in the realm of that. But but whether like on a large scale, like this is going to completely change your whole life, like probably no. So
Yeah, I just feel like there is a backlash against birth control, and there's sort of a reckoning.
mhm,
And I'm a part of a generation that really was taught
mhm,
that birth control is completely natural, in
mhm.
air quotes, and that there are no side effects
Oh
with birth
goodness,
control
yeah.
pills because they are so natural. And there's a
Mhm,
whole generation of women that were like, actually, I feel like crap on these, or
mhm,
I don't feel good, or
mhm,
I am, having significant depression, anxiety, whatever.
mhm.
I hate birth control pills. And then we're gaslit by
Yeah.
doctors that were taught, like me, like, oh, it's natural. You shouldn't
Yeah.
have side effects. This must be all in your head.
Mhm,
And so I think it's just like the pendulum is swung, also the other way, to
mhm.
sort of say, like, oh my God, they're so evil. They, should never be used. There's got to be somewhere in the middle,
Yes.
Yeah.
That's so important. And I say this, you mentioned a talk I gave. Like I always kind of say this in talks, especially to like the general public. If you hear something on social media, on the internet, whatever, and it's any sort of extreme, like everyone should do this. It's always this, it's never this, no one should do it. Like those sort of extreme language kind of comments are almost never correct. In
Yeah.
medicine, everything should be individualized. It should be based on like you as a person, your own history, your risk factors, your preferences. Like, this extremist language of like, no one should do this. It's always bad. Everyone should do this. It's always good is almost never accurate because
Yeah.
everyone's different. So, on both sides, if someone's saying like everyone should always be on hormonal birth control, and if you're having side effects, you're lying, that's obviously false.
Yeah.
But the opposite, where it's like it's going to destroy your body and make you horrible and change your whole personality, and no one should be on it ever, also not right. So
Yeah, exactly. I know,
yeah,
no extremes, but which is
yes,
a better hook? Like birth control pills,
hmm
are evil, or, actually there's pros and cons
there's
to birth control
nuance.
pills,
Yeah.
and let me share this evidence.
Yes. I actually, another thing I always talk about is in general for women's health, there's such an emphasis on risk and not on benefit. So let's
Hmm.
take the example of hormone replacement therapy, where for, once there's kind of this concern about like breast cancer, blood clots, and, heart disease, all of that stuff, that was the primary focus for so many decades,
Oh,
instead of what could it help with, like what are the things it could help you with your quality of life. So quality of life is sort of relegated to almost nothing, and risk is so overemphasized in news articles and headlines and social media, etc., where it's not for men. I was giving an example of
hmm.
Viagra. There's like there are
Sorry, I was
risks
just
of,
like, yeah, I know what
right.
you're gonna say, but like, say it
Yeah,
because
yeah,
it's so
yeah. The
important.
the retinol thing. So
Yeah.
Viagra has has risks, has side effects, including some very serious ones that involve your retina and your vision. But who has ever heard of that? No one. No
Yes.
one. I had never heard of this.
Yeah.
Dr. Jen Gunter, who we were just talking about, a menopause specialist, uses this analogy. Like, no one has ever talked about the risks of retinal damage with Viagra, but everyone knows about breast cancer risk and HRT, and they're actually relatively similar risks.
Oh, that's
They're
so
much lower
enlightening.
than 1% risk,
Yep.
but it's so emphasized in women and not at all in men. And then
That's
like for men, it's like, well, of course you would take it. You need to have erections. You need to have this quality of life. For women, it's like, well, you just have to deal with like the debilitating hot flashes and you can't sleep and you can't focus and, all of these things. Sorry, it's too risky to take this medication.
just suck it
So
up.
yeah, just suck it up.
Yeah.
So that generally for everything in women's health is the case, is that everyone will overemphasize the risk and not tell you why it might help you. So it's not to
That's
say that everyone should take it, but just to say that, we don't at all talk about like, well, maybe you want to prevent unwanted pregnancy, or maybe you want to treat menopause symptoms. It's like, well, don't take it
yeah.
because it's going to give you breast cancer. Like that
Yeah.
narrative is so different. So
Yeah, there's a
yeah.
whole generation of women that really suffered because of bad data that came out
Hmm.
from that
Yeah.
information. I know. Oh my
That'll be our next
gosh.
episode. We'll
Oh
do
my god,
menopause
exactly.
next.
Yes. Oh my god, that would be amazing. Okay, myth number 3. Uh Hormones can be out of balance. How do I check my hormones? Like, I got to get my hormones checked. I got
Mhm.
to balance my hormones. What
Yep.
is this obsession with balancing hormones? Tell
Yeah,
me about
and
it.
I will say, it was called like estrogen dominance, progesterone deficiency. I will tell people, if you were ever told that, no one has ever told anything differently. Like, there's no reverse where it's like,
Yeah.
no one has ever told you're like, like progesterone. Like, anyway, so I will just say that particular line is sort of a marketing line, like and if someone is saying that you have to check your hormones and do all these special tests and like kind of do all of this kind of customize like hormone balancing. Again, it's sort of a marketing thing. So, like if you were to check hormones in most people who are, premenopausal, like they will quote unquote look normal. The exceptions are obviously if someone is having fertility issues, or if they're, kind of having menopause symptoms or skipping lots of periods and they're like under like age 40 to 45, like a typical kind of perimenopause age, then yes, we do need to do some testing to figure out if there's something going on, if there's thyroid issues, if there's PCOS, if there's premature
Mhm.
ovarian failure. So there's an indication to check your hormones to see if something is like, off. But if you're having perfectly normal periods or not having fertility issues, there's really no reason to check your hormones, because on paper it'll just be normal. So we always tell people it's not that the actual level of hormones is the problem, it's how your body's reacting to it. So say you have
Mm.
really bad PMS or premenstrual dysphoric disorder, PMDD, you have really, really bad symptoms, you're having irregular bleeding, that's sort of like your body's response. It's not that the hormone levels are wrong. So in general, if you check your blood hormones, they're just going to show quote unquote normal. Or if you are kind of, in the perimenopause age range or postmenopausal where your periods have totally stopped, and you check your hormones and you're like, okay, well, they're in perimenopause or menopause range, it doesn't change what we do. So that's kind of the 2 points. Like, one, is it even going to show anything abnormal? In a lot of cases, probably not. And then the other is, does it actually change how we manage you? No, because say the case that this is most applied to is perimenopause. Like you're, kind of like heading towards menopause, you're having some of those symptoms. We mentioned hot flashes and sweats and like, brain fog and weight gain and things like that.
Mhm.
Um, if you are having lots of symptoms and your hormones are normal, we're still going to manage your symptoms. So we're going to treat you based on how you feel and not what the numbers are. So again,
Yeah.
it almost doesn't really matter what the numbers are. So like I said, there are definitely situations we do check the hormones, and you've obviously probably talked about this a bunch on your podcast. But it's not that every single person needs to get their labs checked and that they need to be like customized and balanced and all of this, or you have to eat certain seeds at a certain part of your cycle to balance your hormones.
Yeah.
Like that's too much. So I do tell people too, there are some people who like knowing about their cycles and like to track them. That's different. So if you want to kind of track your cycles and use an app, and you want to adjust kind of your exercise and things like that based on where you are in your cycle, like there's nothing wrong with that. But it's just to tell you that there's something like malfunctioning with your body, and the only way to fix it is to do my regimen where we check your hormones like all the time, and then we like, make you compounded specialty hormones is not recommended by any of the medical societies, because just
Yeah.
lack of proof that it actually is helpful.
I
So
think it's really, it kind of goes back to just so many patients not feeling like they're heard,
yes.
and like playing into that narrative of, oh, your Western doctor doesn't care about you. They don't
Yeah.
even want to check your hormones,
Mhm.
but like, do this at home test or come to me for, this
Like there's
like,
hundreds of tests.
yeah.
Yeah.
And, I'll be sure and, charge you a lot for it. And then,
Mhm.
but patients, feel heard, oh
Yeah.
my gosh, someone's actually listening to me.
Mhm.
And so it's hard because I often, walk this really delicate line between, it's not that I don't care about your hormones. Like we could check them, but these levels aren't going to change, what we have to offer you,
Yeah.
or, kind of things like that. Comes up a lot with progesterone, progesterone and
Yes.
fertility. And
Yeah.
what I do is I actually just take 5 minutes and sort
Yep.
of teach my patients. Like, it's
Mhm.
not that I don't want to check your progesterone level. It's just that some random number doesn't tell you what your progesterone is like for those 2 weeks that you're waiting to
Yes.
see if you're pregnant.
Mhm.
And I will give progesterone out like candy. Like, I
Mhm.
don't need a blood test to prove
Mhm.
to you that you need it. I don't think it's harmful. You have to kind of weigh pros and cons
Mhm.
about when to start it and whether to take it. But like, oh my gosh, can we stop checking all these progesterone levels? It's just
Yeah.
that people want an answer.
Exactly. Yeah.
It's, a low progesterone can be one of the first signs of an unhealthy pregnancy that's
Mhm.
not signaling the ovaries to keep making progesterone. It's
Yeah.
not that the low progesterone
Is the
caused the
cause. Yeah.
miscarriage.
So
And
so
it's
much
just
of this
so
is
hard
exactly
you just
just
have to teach,
explaining that. Yep,
Yeah.
exactly. Because that, yeah, I don't
But
do
it's not that I
obstetrics.
don't care. It's
Yeah,
just,
exactly. It's tough because
oh,
just something like just taking that 5 minutes and explaining is the helpful thing, because a lot of
right.
times, like I'll hear from patients, they're like, "Well, I asked, my doctor just said no and ignored me,"
Yes,
because then
exactly.
they feel like, "Well, that you're just kind of being a jerk," like
Yeah.
but to explain, like, here's the rationale, like here's how, like you said, if you just do a random blood level, like again, your hormones fluctuate throughout the cycle, so it doesn't really capture the entirety of your cycle. We're
Totally.
going to manage you based on what we're other things, not just the number. Like there's sort of an explanation for it all. Like you said, the low progesterone is a sign of a pregnancy that is likely not going to progress, and that there's a reason for that. It's not that it's the cause of the miscarriage. So just kind of like giving that information is the important thing. Like that's what's helpful. It's not just
Yeah.
like, okay, well, we're just going to like deny you like what you
Right.
want. And so yeah,
Right.
very
Exactly.
important.
Okay. I love it. Okay. Myth number 4,
Mhm.
painful periods are normal, so
Ah,
I should just deal with it.
Oh my God. This is usually when people say, like, what's one thing you want to leave as a message? I'm like, that is my one thing, is that, severe pain is never normal. Like, whether that's pain with periods, pain with sex, like vaginal pain, like that sort of thing. Like, there's so many times that, like, female pain, especially, is very normalized, that everyone has bad periods, everyone has pain with sex at some point. Like, no, like, that's not true. So, um, if you're having just like regular cramps, like you feel crampy, you take an ibuprofen and you feel fine, like that is normal, like that's common. But if you are in debilitating pain, it's keeping you from going to school, going to work, like you're having to take a ton of ibuprofen just to function, you're taking birth control, it's just not working well enough, you're having some other like concerning symptoms, like you're throwing up, you're like
Yeah.
having horrible diarrhea, those are all things to get checked out, because it could be something like endometriosis we talked about in the other episode, fibroids,
Yeah.
so many other things. So very important to not normalize that. And same thing with sex, like pain, like sex should not be painful a lot of the time.
Yes.
Like it can be a little uncomfortable the first time or a few times, but if you're having pain with sex, that could be vulvodynia, vaginismus, endometriosis, dryness from perimenopause. Like there's so many different things, and there are things that can be treated.
Yeah.
So there are treatments for these things so you don't have to keep on having pain. So definitely
Yeah.
important. And then really quickly, this is also a myth that gets perpetuated because stuff like endometriosis, fibroids, etc., run in families.
Mm.
So, and I say this in the book, that everyone in the family, mom, grandmother, aunts, cousins, sisters, all had bad periods. They all think everybody has this.
Yes.
So then it gets sort of perpetuated, like, oh, just everybody got to deal with it.
Yep.
And then maybe the doctors will tell them that too. And again, it
Yep.
sort of perpetuates that myth. So definitely
Yeah.
that's not true.
We're going to get back to talking to Dr. Tang and busting some reproductive health myths in just a second, but I want to remind you how important it is to support the show. Thank you so much for being here. I still can't believe we have published over 100 episodes, incredible interviews, incredible in-depth discussions, and a huge reason that we are here is because of your support. If you are finding these tips and information valuable that you're listening to, share this show with a friend. If you are listening, wherever you're listening to this podcast, be sure and follow the show so you don't miss our weekly episodes. And please take a moment to give us a review. 5-star review with a little bit of explanation of what you find valuable with the show can help so much. It helps other people find the show and helps us to continue to provide this educational material. Now let's get back to learning more with Dr. Tang. Myth number 5, it's hard to put this into a myth, but you've done some really interesting content on this. But just kind of like on the pain, spectrum, butt pain during my period. I'm the only one that it happens to.
Mhm.
Like, is this normal? Like, is this not normal? Like, what is this butt pain during a period? What is going
Yes.
on?
I will tell you, some of my most viral videos have been about the butt pain thing. And it's because so many people have it and they don't realize that other people do. And they're like,
Yeah.
oh my gosh,
They don't want to
I
talk
thought
about it.
I was the
Yep.
only one. So yeah, like there's actually a name. It's called proctalgia fugax, which is like kind of like a sudden, sharp, like kind of stabbing pain in your butt. And it can be from a bunch of different things. It can be from endometriosis because, we listened to our endometriosis episode to hear about more. But endometriosis very commonly grows right next to the rectum, and it can inflame the rectum and cause a stabbing, like shooting pain. And then also your pelvic floor, which, some of the muscles wrap around your rectum. Like it's almost like a Charlie horse. You can get like a sudden, cramping pain of the pelvic floor or the sphincter of or like the anal sphincter. And so men get this too, actually. So quite a few men in the comments are like, wait a second, I have this too. So it's not just women who have it, but it can be a sign of something else. And actually, there are also treatments for that. So pelvic floor physical therapy, again, finding out if you have endometriosis. So again, actually men go to pelvic PT for muscle spasms around their butt. FYI.
Fascinating.
So, yeah,
oh
right?
my gosh. You heard it here first. Dr. Karen
I only learned that a
Tang.
couple years ago. Obviously on the gynecology side, we don't, have cis male patients, but I learned that. I was like, what? I didn't know they were getting PT for that sort of thing. But yeah, it's true. It's true.
Thank goodness for social media. I think it's like
right?
normalizing. People are sharing things, that might not have happened with like their best friend that they talk to things about, but there are people out in the world. So yeah, that is one good thing about social media.
We will say, the feeling like you're connected and that you're not alone in kind of the things that you thought you were alone in.
Yeah. Awesome. Okay. Myth number 6, tampons cause endometriosis.
Oh, so
I love that I can make you laugh. People really believe this. Karen,
and the sad thing is that for all of these, I've seen like TikToks and stuff where someone is saying this, and like there was one guy, and he was like, it like shoots the blood back into your abdomen, and that's where endometriosis comes from. I mean, like, first of all, I was like, how much force do you think that these tampons are exerting? That it's pushing your cervix is like closed like a fist. It's not like a wide open portal that you're blowing blood back into your body. But anyway, no, it doesn't. So, I mean, the tampons can't get blood back into your uterus, and that's not how endometriosis shows up anyway. So,
I mean, I guess is that theory just coming from like, you're not, you're like holding it. First of all, people don't know anatomy, and that's not their fault. Like, sex ed is ridiculous in the United States, but a tampon is in the vagina. And then there's the cervix, and then there's the uterus up top. And so are people thinking that like putting a tampon in the vagina to soak up the, menstrual flow is somehow not allowing that flow to come
Go
out of the
out.
body, and
Yeah.
therefore it'll back up
That's the
into, through the
thought, I
tubes.
think.
Okay.
Yeah, like that it's pushing it back somehow.
Yeah.
And like I said, I was saying that like if you imagine like kind of like the cervix like a little kind of, closed fist, like how much force would you have to even just through like your fist like to kind of
Yeah.
shove fluids back up through that and also through the uterus and through the fallopian tubes, which are very tiny and
Yeah.
narrow. Like it'd be like enormous force to be able to even get like a drop through. So
Yeah.
it's definitely not the cause. And like clearly
Yeah.
people get endometriosis who don't use tampons and they only use pads. And
Exactly.
so it's a little bit of a ridiculous one. But yeah, there's
Yeah. That's
you know,
okay. This is why we're here.
that's why we're
You
here.
heard it from Dr. Tang. Tampons do not cause endometriosis. Okay. Myth number 7. Hovering over a public toilet is the right way to pee because it will prevent disease.
Oh
Tell
my
us how
gosh.
to pee
Yes.
in a public toilet,
Sit
please.
down. So
Yeah.
this is where, again, the beauty of social media, like there are quite a few great pelvic floor physical therapists. The Vagina Whisperer, the Pelvic Dance Floor, go follow them. They're
Yeah.
great.
Love them.
So they talk over and over again about why you shouldn't hover at public toilets. And I will tell you, I learned this actually a couple years back. I was giving a talk at UPenn with a pelvic physical therapist and she had it in her talk. And I was like, what?
I did not
It's
learn
a
this in medical school,
I
Karen.
didn't either. It's a common cause of pain because the way you hover, you're spasming, you're like tightening muscles that you should be relaxing when you're trying to, pee or poop. You're actually like kind of clenching those muscles, and that is like, it can cause chronic pain. It can cause problems controlling your bladder, constipation. Yeah. So it can cause what's called pelvic floor dysfunction. And, there really isn't any infections that you can get through a toilet seat. They've looked at STIs and HPV and all of that stuff you can't really get from toilet seats. Also because you're not putting your genitals right on the toilet seat.
Yeah.
Like it's like the back of your legs.
Yeah.
So, and then also it's actually, and this is what the physical therapists say, it's actually less messy. The reason the toilet seats kind of have pee on them is because people are hovering and they're getting pee on the toilet seat.
Yeah.
If you sat down, the pee would go into the toilet. So,
yeah.
It's actually more hygienic too. So we tell people like, put down like the toilet paper, put down the little toilet seat cover, whatever you need, just sit down on it. Yep. And this is where just in your house too, the squatty potties that lift up your feet so that your kind of knees are bent and kind of like at more of like a right angle is actually the most kind of healthy, natural way to sit because it actually relaxes your pelvic floor. And they actually say, I don't know if any of you have seen like squat toilets like in Asia.
Yep.
Like where it's actually in the ground. That is similar where you actually like squatting fully and like letting your pelvic muscles relax when you go. Again, same idea as the squatty potty. So having it lifting your butt up in the air and tensing like and hovering is not great. That can be damaging. Letting it relax and sitting is good. So
that also
you heard it here, folks.
Oh, that's awesome. Myth number 8. Your fertility is decreased by half if you lose a fallopian tube.
I love debunking this one. So no, it almost doesn't change at all, which is kind of a cool thing. So say you had an ectopic pregnancy that was in one tube and the tube had to be removed. Your fertility actually almost doesn't change because your remaining tube can pick up eggs from either side. And so with this, you have to use your imagination a little bit. So when you think of like the picture, everyone knows this diagram of like, it looks like a T, like the ovaries are on the sides and the uterus is like the T going down. In real life, your ovaries are kind of behind the uterus and the tubes are kind of like sitting very close to each other. So in real life, they're not like stretched out super far apart. The tubes and the ovaries kind of sit close together in the back. And so it's not that far for the tube to be able to kind of just like sweep in an egg from the other side. And a lot of people, when I make these videos, like people in the comments will be like, that happened to me. I had one tube removed. I know I ovulated from this side because they were going through fertility treatment or whatever. And they could tell that they ovulated from the opposite side and got pregnant. So it's actually quite amazing. And it's part of the reason too that say we remove damaged tubes sometimes, something called a hydrosalpinx where it's scarred and is filled with fluid. And people worry about it like, oh my God, well, you're having my fertility. That's not great. And we say, actually, it improves your fertility because the damaged tube can be detrimental to your fertility. The fluid that's inside of it is very inflammatory. It can, cause miscarriage. It can, prevent implantation of, like, say, an IVF pregnancy. Yeah. So removing the damaged tube and also decreasing the risk of ectopic pregnancy getting stuck in the tube and things like that, you actually have better fertility outcomes. Yeah. So, this is where sometimes you have to kind of explain because it sounds very counterproductive. They're like, "Well, I don't want you to take half my fertility,"
I know.
but the body's a cool thing, and it really
Totally.
will do these miraculous things where you're like, "Well, nope, it works.
Yeah,
It's
I
gonna
know.
suck that ovary, the egg right in from the other side,
Yeah.
and it really
Yeah.
works. It's cool."
Yeah. It
Yeah.
is so cool. And I tell my patients the exact same thing. I'm like, we, show fallopian tubes and textbooks like they're straight out like this. Like
Yeah.
I'm reaching my arms out for if you can't see me. But they're not like that. They're kind of like hanging out by your body and that they can reach over. And I can't tell you how many people think that they ovulate like on a predictable, like
Left, right, left,
left,
right.
right, like
Yeah.
their ovary, like their right ovary and then their left ovary. And I'm like, no, 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 it's much more random than that. So people
Mhm.
assume like, oh, well, if my right tube is gone and I only ovulate from my left ovary 6 times in a year, then I can only get pregnant half of the year. And it is
Mhm.
just not like that.
It's very
Anatomy is
cool.
on your
On your
side.
side. Yeah.
Ovulation from which ovary is not that predictable. It's like a
Yeah.
flip of a coin. And I just say there's a reason we have two,
It's very
like
cool. Yeah.
it's very, very cool. Honestly, and
Oh, really
losing,
quick,
yeah,
I've seen other videos where people talk about this and they make it sound like the tube is like a snake or it like walks over. It's not like that. So people are
yeah,
like, it detaches and then it moves. I'm like, oh, it's not like that. It's just that
yeah,
it can't move autonomously from, like your uterus and
yeah,
your ovary. But it's just that they're sitting so close to each other. It has
yep,
little like kind of feathery ends, which kind of like they can sweep back and forth as your bowels move. And so it kind of like sweeps in like, the egg, and that's how it typically
yeah.
works, but it's not like
But
actually like walking to the other side and picking it up.
yeah.
So,
Oh my God. Yeah, it is. I mean, I think we have the benefit of doing laparoscopy and
yeah. Mhm.
seeing pelvic anatomy. You and I like looking inside and being like, oh, the pelvic organs are all kind of smushed together and they,
Mhm.
it's not just how it looks pretty in an anatomy book. So
Exactly.
it's good to explain that. Okay. All right. Myth number 9. You can't have PCOS if you're thin.
Oh my gosh, yeah. So absolutely not true. So the kind of term is lean PCOS, but it basically just means that like you could be any weight, body shape, et cetera, and have PCOS. And so
Yeah.
this is where I actually kind of think that PCOS is going to end up being many different conditions. Like
Yep.
I think there's just so many different elements to it, and people with
Spectrum.
PCOS can be completely different. Like some people have perfectly normal cycles, other people have completely missing cycles, some people have lots of facial hair and acne, others don't.
Yep.
So I think, some people have like the diabetes and insulin resistance. And so I kind of think it's going to end up being multiple different things. I've kind of just gotten
Totally.
glommed into one
I
big
agree.
pool.
Yep.
So yeah,
And
anyway. Mhm.
when I was going through my medical training back in the dark ages, there's a textbook and there's a picture of this typical PCOS patient. And it's a little bit overweight, especially in the middle,
Mhm.
midsection, sort of that insulin resistance,
Mhm.
fat, adipose tissue being deposited. And, we were all taught like this is what PCOS looks like.
Mhm.
And so there's a whole generation of doctors that haven't kept up with and learning and how much we've learned over the last couple of decades. And they have somebody thin that walks in and doesn't struggle with weight or have insulin resistance. And they say, oh, well, you can't have PCOS. You don't look like
So
that
many people are
person
told that.
in my
Yeah.
textbook. Yeah. So
I've been really surprised. Yeah, like people are like, and I'm like, you have every symptom of PCOS, and they're like, well, but no one's ever like asked me about PCOS or tested my testosterone. Like I'm like that.
yeah.
Okay, all right. There's so many things where I think you have a preconceived notion in your head, and doctors are just human beings, and so they have biases just like anybody else, and so you have a bias of what you think PCOS is, and then you miss anything that doesn't fit that picture. So like it is very
Absolutely.
surprising that people like every classic symptom that there are no periods, lots of facial hair acne, like they're somehow insulin resistant even though they're very thin and they're 22.
Yep.
That like that picture doesn't immediately make them think of PCOS, but yeah.
Yeah. Oh my gosh. Well,
Yeah.
I swear that I did not give Karen the list of myths. We
No.
literally led into our last myth. Myth number 10, my doctor is always right. And kind of, rounding out this incredible discussion, like how can patients advocate for their care? How can they be thin
Mhm.
and, have all these symptoms and just really sure that they have PCOS, but their doctor says they don't, or they have very painful periods that are impacting their daily life, but their doctor says they don't have endometriosis. Like, how can people advocate for their care and get the diagnosis and get the treatment that they need?
Yeah, and yeah, again, I did not know any of these questions before, so that was just an amazing transition to this last question. But But it's true. And I tell people all the time, like doctors are just humans. Like, so a lot of medicine is to just like what was handed down to you from
Yeah.
like the forebears, your mentors, your teachers. And like a lot of times, like it's just sort of what they had heard. And like it may not be like super evidence based. And like medicine is also always changing too. So we're
Yeah.
learning more things and we're getting more data and we have to kind of adjust, our mindsets as we learn more.
Yeah.
So in general, I always tell people if you are not getting answers or improving, so kind of ask the doctor what they think is going on. So like a
Okay.
kind of nice non-confrontational way, but just to say like, what do you think could be causing these symptoms? In medical terms, we call it the differential diagnosis. There's kind of like the list of like, what could this be? Could be
Yeah.
fibroids, could be endo, could be adeno, could be pelvic floor dysfunction. So what do you think is going on and kind of what are the next steps? So, like, do we do some testing? Like, do we try a different treatment option? Do we see a specialist? So, what's going on and what's next?
Hmm.
Are you deserve that, like everyone should get that. If you're getting literally nothing, it's like a brick wall, like this is where you get another opinion, like you
Yeah.
go to see a specialist, and this is where sometimes seeing like a medical specialist with that expertise in that thing, endocrinologist, PCOS specialist, endometriosis specialist, like you might need to go to somebody who does this more often.
Yeah.
And then, the reason I kind of had my book, It's Not Hysteria, was not to like diagnose. There's no way for me to diagnose the reader, but I kind of explain things in a way that, if you see yourself in the descriptions, that might say, okay, I literally have every symptom of endometriosis. I pretty sure, I need to talk to somebody about this. And that's the goal is also to kind of like fast track that conversation. Cause sometimes like, if somebody comes to the doctor, they only have certain amount of time. And, if they're spending 10 minutes just kind of taking your history, like that's time that they don't have to kind of go into like the workup and the treatment options and like the
Mm.
risks, the benefits, blah, blah, blah. So, if you go in and you're like, I think I have PCOS, like I only have periods every 2 to 4 months. I have lots of facial hair. I'm gaining weight. Like I've been trying to get pregnant, for 6 months and it's not happening. Like,
Hmm.
what do we do next? That's already kind of jumped ahead so much so that you have more time so you can kind of dive in a little bit more deeper.
Yeah.
So, like the purpose of the book too is just like educate you enough so that you have like a running start so that when you go to your doctor, like you kind of have something to kind of start discussing and okay, yeah, let's jump in. Let's talk PCOS. Let's talk endometriosis.
Yeah. I think
So,
I think that's something that's really, really important is oftentimes there's such little amount of time and doctors can sort of just, jump to a conclusion and kind of sit with that and then be like, okay, I got to move to the next patient. I
mhm,
think it's really important to just be very open. I am here because I think I have endometriosis.
mhm.
I may be
Yeah.
wrong,
Yeah, yeah,
but
yeah.
like this is what's going on. And like, how can we figure this out? Or
Mhm.
I think I have PCOS and like just state it
Yep.
right at the beginning
Yep.
so that it's not like the doctor trying to elicit all these different things. Like it's
Mhm.
okay to lead it a little bit if
Mhm.
you truly have a specific question.
Yeah, exactly.
Yeah.
And
Oh, how can we
yeah,
learn more from you,
I
Karen?
know.
How can we
So
find
many
you?
things. Yeah. So on social media, it's at Karen Tang MD. So actually, if you go to KarenTangMD.com, like there are links to everything. So my social media, to my medical practice. I'm outside of Philadelphia in Bryn Mawr. And then also my book. So It's Not Hysteria, Everything You Need to Know About Your Reproductive Health, But We're Never Told. So available anywhere you get books. If you have a favorite
Awesome.
local bookstore, a library, all the Barnes and Nobles, all that places. So you can find the book there. And
Fantastic.
yeah, I'd like love to connect with people and learn more. I have a YouTube channel. It's like, it's not that busy as yours. Like I very rarely update it, but I have, I have playlists on endometriosis, GYN surgery, things like that. So
Yeah, fantastic. Oh,
cool.
I just learned so much from you every time
Oh, I love you so
I
much.
connect with you,
This is so great.
Karen. Thank you so much for being here.
Thank you for having me.
I hope you enjoyed this episode. Dr. Tang is such a wealth of information, and she does such a good job breaking down questions and myths and confusing topics into digestible bits and valuable tips. I just absolutely loved this episode, and I hope you did too. You can find this episode and all others at my website, drlorashahine.com. You can find more educational material there with my blog. You can find links to Instagram, YouTube. I just love teaching. Thank you to our friends at Seattle Sperm Bank and Braze Runs Production for sponsoring this show. Thank you to my producers at Audiotocracy for your incredible work and bringing this show to life each week. I'm your host, Dr. Lora Shahine, and until next week, wishing you love, luck, and pineapples.